Hi, everyone. Welcome to this week's Biz Talk. I'm Vicki Janowski, editor of the Greater Wilmington Business Journal. This week, we're checking in with Dr. Paul Kamitsuka, who's an infectious disease physician with Wilmington Health and also the chief epidemiologist at New Hanover Regional. We'll be talking about the latest on the COVID front today, including what the impact of the Delta variant might be, both around the country, but also what we're seeing locally. So if you're watching us right now on our Facebook stream, feel free to go ahead and put your questions into the box, and I'll keep an eye on it during our conversation with Dr. Kamitsuka and pass along what questions that you want to know at this point, what we're looking at locally and with our health situation. But before we jump into our conversation, we'll have a quick word from our sponsors, Cape Fear Realtors.
Hello, I'm Ann Gardner, CEO of Cape Fear Realtors. Realtors support this program's efforts to connect our community in meaningful dialogue with actionable insights. Realtors are dedicated professionals who build strong, resilient communities and businesses. Work with someone you can trust. Work with a realtor. Learn more at capefear.realtor.
Hey, everyone. Thanks for joining us. Today, we're talking with Dr. Paul Kamitsuka with Wilmington Health and NHRMC, who has really been our kind of go-to expert since last spring when COVID-19 first started being something that we were discussing here in the Cape Fear region. So, Dr. Kamitsuka, thanks for joining us on this week's Biz Talk. Appreciate it.
My pleasure.
I don't take this the wrong way, Dr. Kamitsuka, but I really do look forward to the day where we stop talking to you, at least like this, and at least about the COVID-19 virus. But you, like I mentioned, you've been with us through the different chapters, both from the beginning when we didn't know too much about it, through when the vaccines first started rolling out locally. So I thought now would be a good time to check in with you on this latest chapter, which really is about the Delta variant of the virus, a mutation of the virus that has now become the predominant strain in the U.S. And even though cases are still very low locally for COVID-19, it appears something that might be on the rise. So I thought we'd spend some time today to talk a little bit about what do we need to know about this variant? How does it affect people, those who are both vaccinated and unvaccinated, and also what you're seeing locally with patients. So really just to start us off, Dr. Kamitsuka, if you want to tackle some of that and tell us a little bit, what have you been seeing recently?
Okay. So Delta is causing spikes of illness and hospitalization and to be followed by deaths throughout the country, particularly in areas where vaccination rates are low. I will tell you, I just looked at our dashboard at New Hanover. We've got 18 people hospitalized right now with COVID. Just a couple weeks ago, we had 2 people hospitalized. So we've seen a local spike as well, and we expect that that will continue to rise. And the only defense really that we have against that is for people to get vaccinated. It has become astoundingly clear just how effective the vaccine is. Yesterday, there was a report, there were 1,000 hospitalized patients with COVID in Los Angeles County, and 0 of them had been vaccinated. In other words, it's becoming increasingly the case that if you're not vaccinated, you will get COVID and you may get sick enough to be hospitalized or worse yet, succumb to the infection. If you're vaccinated, you are extraordinarily protected. Now, it's still possible you could come down with the infection, but chances are you'll be either asymptomatic or mildly infected. And with any of the vaccines, protection against hospitalization and in particular death from COVID is extremely high, way into the 99% level. So it's really a dichotomy of a dichotomous situation. You're either vaccinated and protected, or you're not vaccinated and you're likely to get COVID. Now, why do I say you're likely to get COVID? Well, it's because the Delta variant is much more contagious than the virus we saw last year. We saw tons of COVID last year, but the the number of people for every person who is infected, how many others will then secondarily become infected, was somewhere in the range of 2 or 2.5. For Delta, it looks like the R0 is 8 people per one person infected are going to get the infection. Much more contagious. And there's data coming out from, for example, Australia, where Delta is surging, where very minimal contact, just passing someone in the hallway may be enough to transmit the infection. So for anybody who's not been vaccinated, the absolute urgency is, first of all, you must mask and distance because you're very vulnerable to getting infected. And second, rush to get vaccinated as soon as possible. And this becomes particularly emergent because, for example, if you get the Pfizer vaccine, that's a 2-shot series, you're not going to have full protection until 2 weeks after the second shot. That's 5 weeks from today. So even if you hop on it right now, get vaccinated, it's 5 weeks until you enjoy the level of protection that those of us who have been vaccinated have. But that's going to be absolutely key. This is a different virus than we had last year, more contagious, and more people, and people who have not been vaccinated are the ones who are going to bear the brunt of this infection.
So it's been shown that it's clearly more contagious. Is there more known about whether it's more severe or not than the original virus?
So we don't know that yet. There's some suggestive data coming out from England and Scotland that hints at that. But one of the things that I really want to emphasize about COVID, we talked so much about the deaths from COVID, which of course is extraordinarily important and tragic. We're at 606,000 or 7,000 deaths so far in the United States from this virus. But there's a lot of illness that happens from the virus short of death, incapacitating illness. We have patients who got COVID last July who are still on oxygen. And you hear about the long haulers, maybe up to a third of patients may experience debilitating symptoms for months after they get the infection. So even if you don't die from this infection, this is not a virus that you want to catch. You can have a lot of symptoms. Most commonly in terms of the long haulers, chronic fatigue, brain fog, really inability to get back to work. And so it's debilitating even if it does not lead to your death. So powerful reasons to be vaccinated. And the vaccines, as we alluded to earlier, are extraordinarily effective. And also what we've learned, there have been, for example, for the mRNA vaccines, the Pfizer and Moderna, well over 350 million doses given. And to date, there really is no significant adverse safety signal. So by now we have a lot of experience with this, and we can be fully confident in terms of the safety of this vaccine. And when I talk to people who are reluctant to get the vaccine, oftentimes they're more afraid of the vaccine than the illness. And the data would suggest that that is absolutely not the way to be thinking about it. The illness is so much worse than any theoretical risk that one might attribute to the vaccine, of which there has been no significant safety signal. So it's really a figment of people's imagination or fear in terms of the vaccine, whereas it's very real. We see it every day among patients who are hospitalized and dying of COVID. That is a virus that will get you if you're not careful. So the key message, if you're not vaccinated already, get vaccinated ASAP and be very careful about attending to masking and distancing with Delta, because it's so much more contagious than the previous virus.
So according to the state DHHS, in New Hanover County, at least about 121,000 people have received at least one dose of the vaccine. You just mentioned talking with patients who have not yet chosen to sign up to get a vaccine dose. Is that safety concerns about the vaccines, is that the main reason you're hearing from patients about their reluctance to become vaccinated?
Yeah. I mean, that's part of it. And so, we spend time sort of going over the information with regard to safety, which is overwhelming. But most of, I think, what we're dealing with is misinformation that people get off the internet. And that is quite a frustrating thing for us who know the real data, to hear people, parroting what they're seeing on or hearing on the internet, which is patently false. It's just not true. And meanwhile, they put themselves at risk for getting this infection, which now is, for all intents and purposes, preventable. We can choose to prevent ourselves from getting this illness if we just get vaccinated. It's as simple as that. And if we don't get vaccinated, we put ourselves at risk, and at much higher risk than last year, as bad as last year was, just because the current Delta strain is so much more contagious. So misinformation and misinformation, and also, I think some people just feel like the vaccine was just rushed into production, so that they don't trust it yet. But this is where really going over the fact that we've had well over 350 million doses already given. This is far more than any other pharmaceutical product ever released in history. There's been far more scrutiny. There is just much more safety information about this vaccine than just about anything else that people take without questioning at all. So that, it'd be different if we're talking last December, but now as of July, we have so much more information that validates the safety of this vaccine, and the effectiveness is unquestioned. 99.2% of 99.2%. That's really almost all cases of COVID now are just among those who have not been vaccinated yet.
So for those who have been vaccinated, what do they need to know about the Delta variant when it comes to transmission? You mentioned that it is possible to still become
Yes.
infected, but
Yes.
perhaps not seriously, but is there transmission risk as well?
Yeah, I think that there is, much less so than if you're not protected by vaccination. And one thing I would mention, you had talked about the numbers of people in New Hanover County that had at least one vaccine. It's very important, if you got the Pfizer or Moderna vaccine, which are 2-shot vaccine series, to get your second dose. The Johnson & Johnson is just a one and done, but the other ones, if you just got one dose, for example, of the Pfizer, you need to get your second dose ASAP. And the reason for that, there's data about this. With one shot of the Pfizer vaccine against Delta, you're only about 33% protected. Whereas if you get both shots, you're 88% protected. And so, and the good news, if you've already had one shot, if you get the second shot, you get full protection 2 weeks after that. So in other words, if you're starting vaccination now, it's 5 weeks till you're protected. If you're getting the second dose, it's only 2 weeks till you're protected. So anybody who's gotten one shot really ought to be getting the second shot ASAP, so long as there it's been at least 3 weeks since their first dose. So that's an important thing to emphasize. Now, for those of us who've been vaccinated, I think I'm still cautious, especially in indoor environments. So if I go to the grocery store, even though I am vaccinated, I do mask and distance. And the reason, again, is because although I'm at very low risk of dying from COVID, I don't want to get the infection because there are, bad things that can happen to people short of death with this virus. I'm too busy to get sick and be disabled by, things like fatigue or brain fog. And so I am careful because this Delta is so much more contagious. I do a lot of hand hygiene with alcohol sanitizer. I wear masks when I'm indoors, like at the grocery store, and so forth. If you're outdoors, you're probably okay without a mask. But still, if you're in an outdoor group setting, for example, in a wedding crowd or something of that sort, then unless everybody else there is vaccinated, I would be masked as well.
And how about, let's talk about what parents need to know with the, especially if they start to see local cases increase. So children under 12 cannot get vaccinated yet. How concerned do they need to be about the Delta variant spreading, and whether children who seem to be at a pretty low risk of catching it, but for those with younger children who will not be eligible for vaccine until maybe later in the year, what kind of things should they be looking out for?
Yeah, well, the children are still susceptible to catching it. They may be less likely to die from it, for sure. But really, if we want to protect our kids, that means everybody 12 and up gets vaccinated. Okay, that's the best way to protect our young children, is for everybody else who is eligible to be vaccinated, to be vaccinated. And the Pfizer vaccine, anybody 12 and over can get the 2-shot Pfizer vaccine, and everybody should be getting that. So if we are concerned about our children who can't get vaccinated, that's the best way to address that problem. Everybody else get vaccinated. And if we do that, we really cut down dramatically on the rates of COVID infection. And the other point to make about the importance of doing that, of cutting down how many infections there are, the only way these variants arise, is if new infections occur. And these variants occur because of random mutations that occur in the process of the virus replicating itself. So if you don't have new viral infections, you don't have viral replications, you don't get mutations, you don't get variants. So the best way to shut down this process of the virus adapting and evolving with variants is to stop infection from occurring in the first place. And therein lies the real importance for everybody to get vaccinated. So we really try to stop this virus in its tracks. So, you know, the CDC just over the past couple of days had released some guidelines in terms of really emphasizing the importance of in-person learning for kids. I can't support that more. I think this past year with COVID has been devastating for kids who are in their educational years. So it's vital to protect our children and to enable them to thrive, that all of us age 12 and older get vaccinated. You know, the other thing is, even though kids may not die from COVID, they can get pretty sick from COVID and also have the same kinds of long haul symptoms. We're seeing this with brain fog, inability to focus or attend to things. It can impair their learning. And so we want them not to get infected so that they don't suffer from that consequence at the same time.
So then again, on the transmission risk, so as the world really locally seems to be opening back up, I know in other parts of the world where the vaccines aren't as prevalent, they're starting to see more clampdowns and shutdowns, but it really feels in the US that things have opened up more than they have in the past year. So when it comes to that transmission issue, particularly for, again, vaccinated parents, is there concern of, again, transmission even if the parents aren't sick, or is it because when you're vaccinated, the viral load that you carry around is decreased as well?
Well, there is some data for that if you're vaccinated, even if you do get infected, you're much more likely not to be sick. You may not have symptoms, but also there's some data that the amount of virus that you shed, and thereby the level of contagion to others, is diminished as well. So all signs point to the benefit of vaccination, both in terms of protecting yourself, but also mitigating the risk for others around you. Again, it just all comes down to vaccination. That's just how important it is. And thank goodness we have excellent vaccines for this. They've really exceeded our expectations in terms of how effective and safe they are. You know, there are other parts of the world that are dying to get a hold of the vaccines that we're privileged to have here. And it breaks my heart to think that we live in a country where we're blessed with this vaccine, and yet we have such a large population of people who just for one reason or another, mostly misinformation, choose not to avail themselves of it, because it would help all of us and certainly help them in terms of protecting them.
Okay, we have a couple questions from Business Journal viewers who are watching us right now live on Facebook discuss these issues. So I wanted to toss them over to you as well, Dr. Kamitsuka. So first is, I think this comes up a lot too. I've heard this question, but if you have previously tested positive, which a good portion of our local and national population has had COVID in the past year and a half, if you've tested positive before, can you talk about if you need to still get vaccinated?
Yeah. So the answer is definitely yes. Even if you've had COVID before, definitely get vaccinated. The good news is that your immune response is going to be very robust. In other words, you'll be very protected if you do that. And just because you've had COVID infection before, the level of your protection against getting reinfected, it really looks like the data is better for vaccine than actually getting the actual disease. And there was a study out of Denmark not too long ago where Denmark had 2 peaks of COVID. So the question was, if you got COVID in the first peak, how protected were you in the second peak? And that the peaks were just a few months apart. And for example, if you were for all age groups, it was about 80%. So having the COVID the first time was about 80% protective the second time. But if you were age 65 or above and got COVID the first time, you were only 47% protected at getting COVID the second peak. And the vaccines are far better than that. You take the Pfizer vaccine, for example, you're 95% protected against getting infected and virtually 100% protected against dying from COVID. So the absolute answer to that is, even if you've had COVID before, you can't rely on that immunity. Get vaccinated, and I would say get back, especially with Delta, get vaccinated ASAP.
And then we have a question about on the other end of the spectrum, which is this potential third shot or booster shot issue. So we have a question about, well, which vaccines are having the most issues, and why are manufacturers like Pfizer and Moderna saying booster shots will be required, but then after that CDC and FDA release statements contradicting that? So what's the confusion around booster shots in that discussion right now?
Yeah, it's so there really is not scientifically, there's not really confusion per se. It's really in terms of where we are right now and when a booster shot will be necessary. I say that because even now, the data is extremely good that the vaccines are highly protective and you don't need a booster right now. As evidenced by the fact that, over 99% of people getting COVID right now are the ones who are not vaccinated. If you're vaccinated, you are protected to a large degree. So really the emphasis right now for the benefit of all of us is to get those who have not been vaccinated. That's the key public health imperative. Now, will we need a booster at some point? We don't know that answer for sure, but the data is looking like, yeah, we probably will need a booster at some point in the not too distant future, maybe late this year. But for right now, this summer, the key thing, it's not a problem right now. The real problem is the people who are not vaccinated and getting the first doses into them. That's the key priority. Now, the only population for which there's some current interest in a booster shot is for those who have immune compromising conditions who may not have responded as well to the vaccine. And there's data that in those cases, you may be able to get their immunity up to somewhere close to where those who have normal immunity and just got 2 shots would be able to have. So that discussion is ongoing at the FDA, and I think that's reasonable. The country of Israel has gone that way, and I think that's very reasonable. Now, much of the Pfizer data that was presented was from Israel, and Israel used the Pfizer vaccine and probably has the most real world experience with that vaccine. And what they did show was some fall off in terms of the effectiveness of their vaccine against Delta now, months after people got their vaccination. So that's the clue that perhaps we will need a booster probably by the end of the year. But again, that's not the issue right now. We really need to push the first vaccine doses being given to those who haven't had them yet, because that's the main problem, both for the unvaccinated as well for the as well as for the vaccinated population.
Okay, and just to wrap us up, Dr. Kamitsuka, what will you be keeping an eye on in the weeks and months ahead? What's gonna, I guess, take up most of your concern as you're watching to see what happens with the Delta variant?
Right. Well, the Delta and other variants. You have the South African variant, the Brazilian variant, and if we have unchecked infection, we will have other variants. This virus is adapting more and more to the human population, as pandemic viruses tend to do. And the more unchecked infection of populations, the more mutations and variants that we can expect. So that's what I'll be looking out for. Every day I ask every patient I see, have you gotten vaccinated yet? The key thing is to get people vaccinated, because that's our major protection. And the other thing, just to emphasize, once you're vaccinated, you really do have, it's really a liberating thing to not have to be so worried about this virus. I think with Delta, we need to be careful, even if we are vaccinated. But if I'm sitting around a dinner table where everybody's been vaccinated, we don't wear masks, we enjoy ourselves. And it's a great thing to be able to do that.
And I know that that's just speaking with you, a big difference from where we were last year and having these conversations and how you personally felt. So
Right.
it's interesting how just 6 months has made a difference.
Right.
But as always, thank you for the latest update. We appreciate the info and you breaking down what the newest is that we have to see. Again, I hope one day that we are talking about something else,
right.
meeting in a different way than this. But in the meantime, we appreciate all the knowledge that you share with us on that and providing those updates for us.
Sure.
To everyone who's been watching, thanks for the questions and thanks for tuning in. We'll be here next week on a different business and health topic as well. If you want to catch up on previous BizTalk conversations, you can go to WilmingtonBizTalk.com or check it out on your favorite podcast streaming. And we will also have Dr. Kamitsuka's video in our afternoon news email today if you missed the beginning of it, so you can catch up there as well. So thanks everyone. Appreciate all the thoughtful questions and dialogue, and we'll talk to you later.